which sets the stage for our next presentation, which is our last presentation of the day with Lisa Martin. And I see you here, Lisa, so feel free to share your slides whenever you're ready. And she'll be sharing her presentation on growing with families to walk in our strengths, the Family Spirit Home Visiting Program. And I'm happy to introduce Lisa, who is a member of the Ojibwe Nation and an enrolled member of the Sault Ste. Marie Tribe of Chippewa Indians. And Lisa is a senior research associate at the Center for Indigenous Health at Johns Hopkins University, Bloomberg School of Public Health. Her current role is to support Family Spirit Home Visitation, curriculum content development, and research projects associated with the Family Spirit implementation. So welcome, Lisa. Thank you for joining us today. I'll hand it over to you now.
Great. Thank you so much, Alicia. Can you hear me okay and see my screen?
Yes, everything looks good.
Okay, thank you so much. And please feel free to let me know. One thing I'm not really good at is responding to questions while I'm presenting. It seems like I can only do one thing at one time. So if there's a question, Alicia, if you want to let me know, I'd be happy to address it whenever I can.
I got you.
Okay, thank you. Miigwech. Well, winabujun indinaway magani du gawan ikwe indigenakas makwa do deimbao tagun indonjaba anishinaabe kwe andao. My name is Lisa Martin, everybody, and I'm just so honored to be here with you all. I was listening to the presentations before this one, and I'm just so inspired at the work that is happening in our communities, and it's just really an honor to be included with everyone today. I've also been so excited to be included in this space because I've always had this dream for Family Spirit and home visitation programs to be known by our communities, by our tribal leadership, by our health leadership, to be synonymous with programs that are really high impact, high value, and that are reclaiming and promoting our ways of life. So I'd love for our tribal leadership and again, in our communities to know about home visitation and Family Spirit like they know about programs like Head Start and clinical care and community health programs and other programs that are widely provided. And in listening to the presentations prior to this too, I would love for them to know about, midwifery and really deeply understand what that is and the importance of breastfeeding. That's all language that these venues support in carrying that message to the people that need to know about it. And so again, just happy to be here. So I'll get started on this presentation, but before that, I wanted to acknowledge our team. And the work that I'm presenting is not all mine and involves a large and amazing team of professionals dedicated to supporting our families. And so here's a list of them, and there are absolutely definitely more, but I did want to acknowledge our team before I start talking about this, and also to acknowledge the communities and families that have played a critical role in advancing home visitation science and developing new resources. Family Spirit was developed by and for Indigenous communities. And so this presentation and this work is dedicated to those people with that vision. So getting into the objectives, Family Spirit is a preventative tool for supporting families in their journeys. It can be useful at many levels of the prevention spectrum in supporting families in their path. And so we're going to talk a lot about what that path might look like for families and how Family Spirit can be a supportive tool for communities. We know that there are connections to our Indigenous teachings and worldviews with Family Spirit implementation. And for this presentation, I share a bit of a personal perspective to those connections from what I was taught and what I've learned so far. And so some of the slides are my own views on how I see the connections, and you all might have different ways to see things according to your community and family teachings. And I want you to know that I hold respect for that. And so we may see or feel or hear some similarities between those teachings too, and that's good too. And I hope that the information that's shared will reflect our journey growing the Family Spirit curriculum through strength-based approaches to supporting families. And also wanted to acknowledge that there are going to be some slides that I go through quickly, but I did provide a slide on them because there's some citations in there that I wanted you to make note of if you have interest, and so you're able to check those sources on your own for more information. So if I go through something that you didn't get enough information on, hopefully that citation in there will help you access that information at some point if you're interested. Maternal and family health outcome inequities are the direct result of federal policies that damage Indigenous practices that are protective. It was a strategic process. And I just wanted to take a moment to recognize this perspective that is there in presenting this information. It's important that we acknowledge this for a topic, and we could spend days on talking about this, but the intricacies and cycles and trauma and impact on our people are just absolutely undeniable. So I want to mention that I'm not going to talk a ton about this, but I want to mention also that I don't mean any disrespect by doing that. But when we talk about family spirit and strengths-based promotion and prevention, it's important that we understand that we're coming from a space of understanding that healing, that wrongs happen to us and that healing needs to happen from them. Federal policies indicate that the United States viewed official disruption to the Indian family unit as part of federal Indian policy to assimilate Indian children. Quote, the love of home and the warm reciprocal affection existing between parents and children are among the strongest characteristics of the Indian nature. And that's an excerpt from the Federal Indian Boarding School Initiative investigative report. And so when we consider the other avenues of assaults on our people, we need to acknowledge the assimilation practices and how they contribute to trauma and the need for healing in our families and communities. And even then, even though it was used for a different purpose, the strength of our families was recognized. And in a sense, for me, that brings hope, because our families are still strong they're still strong to have survived, and our families are still strong. And for those that need help, we can support families in being strong again. So these traumas are experienced by us all in different ways, and the path through healing from them are experienced by each of us in different ways as well. So I wanted to begin by laying some groundwork for how we see where family spirit and home visiting fit into the prevention and the healing and the advocacy for equity aspects of addressing maternal and family outcomes, because it has a role in each of those areas. From a prevention perspective, this is where we see family spirit and home visitation serving our families. The circle that you see here showing one type of intergenerational adverse childhood experiences is not the story for everyone, but it is the story for many. So an individual can start anywhere in the cycle, and these traumas can be felt for generations. And we feel really strongly that and the science shows too that targeting parents and supporting them in a way to support breaking the cycles of these traumas is important. So there are different interventions that can address parts of these cycles. Where family spirit fits in is as an upstream prevention approach to support parents with a program designed by and for tribal communities. And it can have a significant impact on maternal and family health outcomes. Family spirit supports and promotes equitable treatment of families. For me, in my own journey through understanding equity issues, I've always identified home visiting and family spirit as a significant support for addressing systemic maternal and infant inequities. Family spirit addressed equity in terms of developing a program by and for Indigenous communities, which leads to the ability of the program to address systemic equity issues as a result of implementation. So just even developing a program by and for Indigenous communities fights back against those inequities. There's a couple of levels by which family spirit and home visiting address equity. And on a programmatic and content level, family spirit was developed by and for tribal communities, like I mentioned, but it was grown from communities. And family spirit has been developed so that people are passionate about family health. Those are the ones that are teaching the community about family health. And it energizes the message and the ability to develop relationships between home visitors and participants. The relationship between home visitors and participants is something that is really important to the successful implementation of a program. And it's something that we hear from people that is like the secret sauce. Like what made you make this change, or what helped you when you received your home visitation? And that relationship between the home visitor and the family family is always mentioned as a really critical part of that. And then at a systems level, home visitors navigate families through systems that were not built for them. And in some cases, systems that were where historically cards have been stacked against them. And so home visitors become a constant ally in working through these systems and can and do facilitate walking through challenges that lead to better outcomes. So family spirit's impact and connection to healing for me is something that I think through from the perspectives of teachings that I've been able to hear from my community. There are opportunities to support healing for families while we support connections for our children to this information. And so often we learn new things along with our children during this stage when we become parents. And when I was thinking about this, I was reminded of some of our medicine wheel teachings. So the way I learned was the medicine wheel represents the process by which we move through different stages we go through in life, and it can represent a lot of different things. But one of the stages that we hear most often about is our lifespan, and then birth, which includes birth, youth, adulthood, and then becoming an elder. And the medicine wheel moves from stages starting in the east, so that yellow there, to the south, west, and then to the north. And so that's how I was taught that we move through that wheel. And so we all have different journeys that we take through life, and many times we can be an adult starting a journey for an aspect of life in the east. We don't have to always be a child starting a journey. We start journeys at all points and all ages in our life. And so we start at the east again in our learning process in parenting, having a point in time where our parenting skills are in their infancy, and then we move through that circle as we gain our skills and we gain confidence and we learn from our mistakes and challenges. And then sometimes if we have another child, in my experience anyway, each child for me was like starting over in that wheel and learning to be a parent to them. So there are times also that we can be stuck or stay in one of these aspects and not move forward. And for many of us, due to colonization or trauma or historical trauma, even racism or whatever the reason is, we can get stuck or even stay at the beginning. And so when we support connections to milestones or aspects of life, when there are times where we support both the child and the parent in starting these processes together. And often parents are learning right along with their child about some things, and that's okay. It's a really beautiful form of healing. And it can also be challenging for both the parent and the child and the entire family. And so family spirit acknowledges that no matter what it is, we all start somewhere. And sometimes we're starting to learn with our children, and sometimes that learning for caregivers is part of their healing process. And so that's where I see that connection to the medicine wheel in our teachings. So I wanted to talk a little bit about, not a little bit, hopefully provide you a good overview of family spirit and some of the background to that. Before I did that, though, I wanted to talk a little bit about the history of home visitation, because home visitation is not a new intervention. Home visitation has been around for quite a while. A wide range of communities, especially Indigenous communities, had well-established social and cultural practices to protect, support, nurture, and educate new families and young children. We had our aunties, we had our extended family. We also had the environment too that gave us knowledge around how to take care of our families. And so we had intergenerational and extended family members with special knowledge and skills and roles that they played collectively to help manage pregnancy, births, breastfeeding, and child and family development. So it's not new. It's not new to Indigenous communities, and it's also not new historically in the US as well. Home visitation has been around for quite a while. Contemporary programs are based on recent decades of research showing improved child and family outcomes associated with home visiting programs. And in some ways, tells us again what traditional roles and ancient wisdom has already told us before. And so I just wanted to acknowledge that. Very quickly, I wanted to provide a citation for this article for you related to some outcomes for home visitation in a Healthy Start program that was implemented in American Indian community. And so it's a really busy slide, but the message here is that the message here is that home visitation showed a protective effect for rural and low-income participants. In this study, the odds of receiving inadequate prenatal care, which can be a proxy for the health and well-being of the mother, and having a low birth weight baby was almost 3 times greater for a woman who was not receiving home visitation services. And it's also notable that the infant mortality rates for participants in the home visitation program was lower than for non-participants. But the number of infant deaths, it's also important to note, was too small to assess statistical significance. So I would really encourage you to further explore this article if you have the chance. I also wanted to share in this diagram about how family spirit and home visitation can connect to the best of both worlds, because to me, this is also related to healing. There are places that our worlds can benefit from each other. And this diagram was from Melody Redbird Post in her dissertation, which was beautiful and something that I also highly recommend to check out. References the intersections from the work of Vine Deloria around the relational way of thinking we have as Indigenous people and its relationship with the linear way of thinking. And it's a great representation of the best of both worlds and how we can take advantage of those places. Medicine people that I know that help in this way of life have also talked about there are many ways Western medicine can help us, and we should also use that when we can or when we need to. And so a goal of Family Spirit is to ground and support and uplift this relational way of thinking and connect it to the best supports of medical and prevention science. Finally, before we get more into Family Spirit, I want to talk about this time, pregnancy to age 5. And I think we've heard it in the presentations all day, but it's one of great opportunity and great vulnerability too. This is a time of brain growth and elasticity in children where physical changes happen, and expanded capacities of the postpartum being and brain as well. So it's a really powerful period for caregivers. And as motivation, we often hear of the hope and dedication of doing things differently from parents and caregivers than what we're experienced growing up. We hear that a lot about, well, what's the reason you want to be in this program? Or, what do you want to do for your child? And a lot of the time we hear when somebody has experienced trauma or experienced something hard early in life, that they wanted something different for their children. So it's a sense of a fresh start or a window of opportunity to laying a strong foundation. But again, like I mentioned, it's also a time of vulnerability for both children and caregivers. There's potential for injury or illness, abuse, trauma, stress, many different things. And so there are traditional teachings around protecting from specific or upsetting exposures during this time. And so it's really vulnerable too. So we'll get into Family Spirit and why we're here and why we're doing this presentation. But I did want to talk about some of those things to show you the connections that Family Spirit has to those ideas and concepts. The Family Spirit program, I think I mentioned, is the largest and only evidence-based and culturally tailored home visiting intervention program designed specifically for Indigenous families. The Family Spirit program consists of 63 lessons to be taught from pregnancy to the child's 3rd birthday, though we're currently working on expanding the curriculum content to age 5. Family Spirit can be implemented with parents and caregivers across the age spectrum, including with dads, aunties, uncles, grandparents, or any other type of caregiver. We see Family Spirit used, for example, in foster care settings and in other different types of settings. Parents gain knowledge and skills to achieve optimum, parents and caregivers gain knowledge and skills to achieve optimum development for their children across the domains of physical, cognitive, social, emotional, language learning, and self-help. It's home and family based. So Family Spirit recognizes that a family is key in our culture and that many people help to raise a child. So we make this available in the home. and also where it may reach generations of caregivers in that home. Native paraprofessionals, Indigenous paraprofessionals this is who the program is designed to be implemented by. Family Spirit is really a core of the program. Family Spirit is the first program to provide clear evidence of the effectiveness of paraprofessionals as home visitors, and really to capitalize on the strengths of paraprofessionals who know the community, who may know the culture, who know local resources, and can relate to families. And also for implementation in places where there's a shortage of nurses or other types of professionals to deliver home visitation. It's also had successful implementation by nurses and by professionals with different training and backgrounds, including social work. So it's not to say that that it's excluded to be a home visitor within those professions. It does work that way too. But it was originally developed for paraprofessionals, and it works really well that way. Family Spirit is strengths-based and focuses on the strengths of communities. And also, I mentioned it's evidence-based. It is on several national registries as well. To give you some examples of what lessons are included in Family Spirit, I mentioned the different domains, but there's lessons around goal setting, parenting and well child care, reproductive health, nutrition and responsive feeding, and kind of the list goes on here. Family planning, substance abuse and depression, prevention and referrals, conflict and problem solving, even lessons around budgeting or preparing children for school. There's a lot of different lessons within that 63 lesson catalog. A little bit around the research basis for Family Spirit. Enrollment for Family Spirit clinical trials began in 2006. So Family Spirit has been implemented basically since then. During the study period, however, 322 expectant teen moms participated in the study, with 159 moms in the treatment group and 163 moms in the comparison group. Family Spirit showed significant impact in the following areas, including increased maternal knowledge, increased parent self-efficacy, reduced parent stress, improved home safety attitudes. In the mother's outcomes, there was decreased depression, decreased substance use, and fewer risky behaviors. And then finally, in child outcomes, there were fewer social, emotional, and behavioral problems through age 3 and lower clinical risk for behavior problems over the life course. So a lot of really significant impact by that initial trial. Here's a closer look at some of the child outcomes, just really briefly to explain what is meant by externalizing, internalizing, and dysregulation that we have on this chart. Externalizing behavior is described as aggression or defiance or peer aggression or activity impulsivity. Internalizing means is described as general anxiety, depression, withdrawal, separation distress, or inhibition to novelty. And then dysregulation behavior is described as negative emotionality, eating, sleep, and sensory sensitivities. So these are some of the impacts that were tested and measured during the randomized controlled trial for Family Spirit. And you can see, so when we look at the data for children's outcomes, which is kind of where the rubber meets the road for all home visiting programs, how children were ultimately impacted. Family Spirit children whose results are represented by the orange column experienced highly significant and clinically relevant drops in developmental problems in the 3 key domains I just described. And the red line shows where they met or fell below national norms despite living in some of the most stressed communities in America. So these were really, really telling and really, really good outcomes during that trial. In addition, the data show here that Family Spirit results were strongest in children born to mothers at high risk for substance use. So that's another finding from that study. So we've spent many years implementing Family Spirit. I mentioned that first trial happening in 2006, and Family Spirit really has just grown year by year as implementation has continued to happen across the country. We've learned a lot from families and communities and home visitors as they implement the program. And one thing I'm just so proud of is what we've done with the lessons that we've learned from implementation. Family Spirit continues to grow and add to it where it needs to, and modify itself where it needs to. And so we understand now that a one-size-fits-all approach doesn't work for everyone. And so the analogy we use is, if you have a bowl of fruit, not everyone needs or wants the same things or all types. So instead, we're thinking about how to better match preferences and needs. So some people may get apples and some people may get grapes. Another way to visualize this is with some Legos. So trials did show a favorable effect in maternal depression, but the effect size was small. So we know that Family Spirit works well for some families, but we have to recognize it leaves unmet needs for others. So while Family Spirit seems to be helpful for a percentage of families who use substances, it doesn't make a difference for all families who may need something else. And so we're looking into understanding and knowing what to provide for somebody that needs something else. Knowing that in some communities, 50% or more of women of childbearing age abstain totally from drug and alcohol use. Does it serve them well to spend time delivering substance use related content? And so these are the types of conversations, and these are the types of research we're engaging in around how to better serve families and design program structure for them that better meets their needs. So some people are fine with those core lessons that I showed you, and some people are perfectly fine receiving those, but others need something more. And so given the complexity that families face in terms of their needs, they might need more in depth in some areas. And so to get where people need, they might need more support. And here are some areas that we've been doing a lot of work with the Family Spirit theme, within the Family Spirit team, about offering these different options from areas that we've identified that families need more information and they want more support. So I'll quickly talk about these. I wanted you to know that Family Spirit Nurture is actually available now publicly. If a program has an interest in doing it, there's an online training, and then you can utilize Family Spirit Nurture, and I'll talk a little bit about what that is, but you can utilize Family Spirit Nurture with your community, even if you're not a Family Spirit model affiliate. So Family Spirit Nurture is a nutrition-focused supplement to Family Spirit, where 6 nutrition-related lessons were delivered to families 3 to 6 months postpartum. The focus of the lessons was around promoting no sugar-sweetened beverages and delivering education on optimal breastfeeding, responsive feeding, and support around introduction of solid foods. The study was designed to prevent obesity and promote healthy growth during the first really critical 1,000 days of life. And the randomized controlled trial showed that those that received Family Spirit Nurture reported feeding children substantially fewer sugar-sweetened beverages and demonstrated better responsive feeding practices. So like I mentioned, Family Spirit Nurture is available to anyone that would like to use the tool with the training that's provided. Family Spirit Strengths is a 6-lesson module designed to be delivered weekly or biweekly. And the primary target for Family Spirit Strengths are caregivers that are struggling with mild to moderate mental and behavioral health concerns. On the continuum of caregiver needs, there are families that are not experiencing mental or behavioral health concerns, and those that have mild or moderate concerns, and then those that have severe concerns. And so Family Spirit and home visiting protocols dictate clearly what to do with severe mental and behavioral health concerns. But Family Spirit Strengths was designed to fill a need for those that have concerns, but for whom it wouldn't be appropriate to provide support through a home visitor in a home visitation setting. So we're looking at the middle here, the families who struggle with mild and moderate mental health and behavioral health concerns for Family Spirit Strengths. Family Spirit Strengths is informed by the CETA, or Common Elements Treatment Approach. And we chose to explore cultural adaptation of CETA because it's evidence-based and been used in a wide variety of countries. It elevates the capability of local community members to deliver mental health supports with the proper training and proper support, like community health workers and paraprofessionals like are identified for Family Spirit. It also addresses comorbidity comorbidities, which are common. Anxiety plus depression. A lot of times depression is mentioned and addressed in programs, but anxiety isn't. And so anxiety and other comorbidities are addressed and supported through Family Spirit Strengths. The process is also supported by standardized screening tool and training for Family Spirit home visitors on social support visits and responding to a participant who is in crisis mode. And we hear from home visitors that this is often the case when responding to the needs of the family. And then Family Spirit Strengths is delivered with referrals and connection to community services as well. Moving on to Family Spirit Languages Medicine, this is another module that we're so excited to be working on. Family Spirit actually Strengths is in a randomized control trial right now, so not necessarily available to the public, but we're hoping in the next few years will be available. Family Spirit Languages Medicine is a 5-lesson curriculum in a pilot phase right now. It's intended to be delivered over a 5 to 6 week period, and the curriculum uses the teach, model, coach ways of interacting with a family, and it's embedded into family and cultural routines. It promotes talking to your child, caregiver talk. It promotes that social interaction between a parent and a child, and it also promotes book reading, because we know that's a really important aspect of child development. And like I mentioned, this is in the process of being field tested. I'm moving through these quickly, I apologize, but I do want to honor the time that we have together. Next, we have Family Spirit Thrive. Family Spirit Thrive is a 20-lesson module to be delivered to children and their families between the ages of 3 to 5. Home visiting programs have been asking for this type of curriculum material for a long time. And so the lessons are rooted in the values that children are sacred. There's a focus on interconnection to the parent and the child, extended family, and to the environment and community as well. There's an Indigenous foundation of lessons and the idea that we need to honor our ancestors and build on strengths. So the lessons promote Indigenous language whenever we can and includes traditional teachings and life ways where it's appropriate and in a way that a community can adapt the curriculum to those teachings and ways of life of their individual community or family. It's intended to build school readiness with content, to nurture development, and to focus on connections to extended family, like I mentioned. And so the curriculum encourages the community and family to further explore their cultural traditions that support early learning and development. And finally, I'll quickly highlight the work by Dr. Jenny Richards, which is in its formative stages to explore and describe the role of Indigenous doulas in improving maternal and infant outcomes. It's part of a multifaceted strategy to address significant disparities in maternal and infant mortality. And it's responding to a surge of interest from communities in acknowledging and restoring and expanding access to traditional protective practices and knowledge. And the vision is to uphold birth as a sacred experience more than a medical event. And so that's a really exciting work that she's doing. There's a large body of evidence showing that, or there's a body of evidence showing that doula-supported labor in general is associated with reduced medical intervention and fewer complications. So exciting work coming from Dr. Jenny Richards. I want to say that we continue to learn from the implementation of Family Spirit, and this means emphasizing the relationship-based nature of home visitation. A significant focus in our training is on leveraging family strengths and this joint learning approach, because when we hear from our home visitors, we know that we're learning as much from families as they are learning from us. And so there's that balance there. And there's a sense of, let's take a look at this together, rather than a more medical model of an expert provider providing information to somebody. Our goal is to really walk on the path with families and walk together with them and meet them where they're at. So in development and research, this means using community-based practice methods and ensuring and supporting Indigenous voices every step of the way. And there are many ways for us to walk in our strengths and to support families in doing so as well. Our communities have the answers to what they need, and it lies in our culture, in our teachings, in our languages. And we hear this over and over again when we're developing new curricula and when we're working on new programs in response to what we're learning from Family Spirit implementation. So it's our sincere hope that Family Spirit is a way to uplift that and provide support for families. And I also just want to acknowledge that Family Spirit and home visitation is an important piece of the system of care that families are receiving that impact health. The presentations that you've heard so far and other examples that are listed on this slide are also part of a system that impacts what happens to our family during this important and transformative time in their lives. And we acknowledge the work and the transformation and support that needs to happen within these systems so that families can have the best and have the outcomes that they deserve. And we know that the life context of birthing people and what happens to them and how they're treated around birth and in early childhood matters deeply. As Cami was mentioning, these things affect our DNA. And so when we're helping families to, like she was saying, and I fully agree with and believe that we are also helping with healing or helping with healthy DNA development for our children and for our families. What we do and how we support families impacts, the next 7 generations. And so our thoughts are around supporting that, but recognizing that we work within a system and we work within multiple programs that need to be there to support families. And so we just, really wanted to acknowledge that. And finally, this is a concept that I've learned a lot from this idea of birthright. And every Indigenous person here has a right to know and experience their way of life. And I've heard elders say, like, phrases like, these things were put here for us. Like, we were given these things. They were intentionally put here for us. And so I feel like this work that we're all doing to support our families contributes to that. And I just, again, want to express my thanks for the presenters and being included here, but also to every one of you for whatever your role is in supporting our families and children. Miigwech for what you do and for what, you're doing to support us all and into the next 7 generations. Miigwech, everyone, and that's the end of my slides.
I saw lots of hearts, so thank you, Lisa. Now we'll open it up for some questions, discussions. I see some reactions. So I want to start us off with the question. So in your experience, what has been the most rewarding aspect of witnessing positive transformations and outcomes brought by the Family Spirit Home Visiting Program? And I see your hand, Rebecca, and I'll pass it to you after. I'll drop it in.
I'm sorry. Can you say that again? Read the question.
Yeah. I know I just threw it at you randomly. Okay, so in your experience, what has been the most rewarding aspect of witnessing of positive transformations and outcomes brought by the Family Spirit Home Visiting Program?
Well, for me, I can tell you a personal rewarding experience is when you become somebody that a family remembers impacting their life. Like, I think we all have a person that hopefully we all have a person or something where somebody that helped us during a really important time in our life. And I think that's something that I hear over and over again. And I feel just really grateful to be a part of is when something that you're involved in, somebody remembers that and said, I remember when I got help at a time when I needed help, or when I had a need, or when I had a need to know something. And so I think for me, I don't know if that makes sense, but just being in somebody's memory or being part of something in somebody's memory that helped them when they needed it is really rewarding. And I appreciate it.
Mm-hmm. Thank you, Lisa. I'll pass it over to you, Rebecca.
Thank you. I am a prenatal visitor for a program funded by Early Head Start. So I'm curious to know, besides what you already shared, what are some differences and similarities? Because Early Head Start is nationwide. So I'm interested to hear more about that. Thank you.
Sure. I'm not as familiar with Early Head Start in terms of like the visit structure and how you do that and how that works in terms of how you select visits. I know that, so I can't say in terms of the differences, but what Family Spirit has is the 63 lessons, and then they have a visit structure that's suggested for pregnancy to postpartum. And then there's an option and support for families' autonomy and what their needs are too. So, listening to families about what their interests are, what types of lessons they would like to do, like there's options for that as well. And then I think the growth into areas like maternal mental health and expanding into age 3 to 5, I think and we work very closely with the Office of Head Start. There's a lot that we've learned from them too about what it means to serve the whole child on all aspects of the child. So I think the programs, without being able to speak to the details around implementation for Early Head Start, there's ways that they work together really well. I hope that answers your question.
It does. I just need to do my own research. Thank you so much.
Mm-hmm.
All right, I have one more question and I'll put it in the chat too. So looking forward, how do you see the Family Spirit Home Visiting Program evolving to continue addressing the needs of Indigenous families and communities in promoting maternal health in culturally responsive ways?
Well, I think we just continually see the importance to supporting families in returning to, in whatever way they feel comfortable, to the teachings and traditions of their community. I think supporting and facilitating that is something that's really important to us, and we look for the best ways to do that all the time. We're constantly adapting for how we can support those connections in a good way. I think the development of Family Spirit Thrive is one way that we've responded to that as well. We took the approach of really listening to the community about what needs were there, but also what we're grounding lesson content in. So grounding it in our way of life means that we start there, and then we build a lesson and we build what we want to deliver the family from there. So when we write about a family in Family Spirit Thrive, we're also talking about our environment. We're also talking about our community, and we're also talking about our extended family, and acknowledging from the baseline, or from what we're doing, our connections to our culture and our teachings around them.
Thank you, Lisa. We had a question from Crystal. Has Family Spirit been implemented in urban Indian communities?
Yeah, we do have several affiliates that are implementing Family Spirit in urban settings. Yes. We also have Family Spirit affiliates that are through non-Indigenous organizations, and they find that they like the model and have decided to use it with their communities too. So there is that variation. We have tribally based programs. We have many different kinds of programs that implement Family Spirit, including urban Indian community programs. I see a question, how can we become an affiliate? Sure. So I would recommend, and I can facilitate this if you want to contact me, contacting the Family Spirit program. There's an email address that you would email. You can get all of the information you'd like about becoming an affiliate. And then there's a process for contracting and everything. But I'd be happy to follow up with you. You just have to visit our website though, if you are interested in learning more about becoming an affiliate, or I can support and facilitate that process too.
Awesome. Did anyone else have some questions? I really enjoy just learning more about what Family Spirit is doing, and just recently learned about that partnerships expanding beyond just the US and internationally now. So lots of exciting things to come, and thank you for joining us today, Lisa, and sharing your work with us. It's very exciting and inspiring. So I hope you have a great rest of your day.
Thank you so much. It was such an honor to be with you all today.
Okay. Oh, quick question, actually. with Shay's question, wondering how can she have a conversation with Dr. Jenny Richards regarding the doula workforce? I believe her email might be on Johns Hopkins Center for Indigenous Health, but I advise to you.
It is, absolutely. It is on our website, but if you want to email me, I can also support connecting you as well.
Awesome. Well, thank you so much, Lisa.
Thank you. Thank you all.
Okay, well, so that concludes our 2023 American Indian Alaska Native Maternal Health Promotion Institute. I want to thank our incredible speakers for joining us over the past 2 days and sharing their knowledge and inspiring work that everyone is doing. And thank you to everyone all of you for taking the time to join us in this space. You know, it's been a successful gathering of minds, hearts, and shared solutions on the well-being of our Native mothers, our birthing people, families, and communities, our babies, or your babies. And it's clear that there's still much more ground to cover and an ongoing journey to advancing maternal health promotion and ensuring health equitable solutions are within our communities. But however, like Cindy mentioned earlier, I'm also filled with hope in reflecting on the Institute as a whole. I'm really feeling feelings of optimism, being optimistic after hearing all the great work that's being done and what else is to come. And just want to know that it really is special to see where our collective efforts will take us and focusing on our strengths and resiliency rather than on deficits and disparities. You know, we heard from our presenters and their work using strength-based and culturally grounded approaches that will continue us on the path towards a healthier future for our Native families and communities and the generations yet to come. And some quotes I pulled from today were first from Nicole on sharing that trust is our most valuable asset and power. And from Rhonda, she shared that, you know, we're more than our disparities. And from Cami, she shared that it's all up to us to support the parent and it's our responsibility, the community's responsibility. And the message from Lisa I took away was that, you know, a one size fits all approach obviously does not work. It's inequitable and will not meet the needs for our Native communities. And I like that. I think it's an analogy that you use that some people may get apples and some people may get grapes. So those are most of my reflections that I have right now. You know, I still have much more to learn in this work, and I look forward to future convenings like this. And I hope I see some of you at future conferences or meetings or more Zoom meetings. And feel free to reach out if there's any way I can support or help or uplift your work in any way. And I enjoy just learning from all of you. You know, I felt all the love and support on Zoom or offline, and having some friends attend to and sharing the uplifting messages. So that was very, I greatly appreciate it. And I thank all of you for the work that you're doing as well and taking the time out of your schedules to join us today. I also want to open it up and take this time for some reflections and would love to hear from others. You know, I'm wondering if anyone wants to share their thoughts you may have on where efforts are still needed or anything new you learned, questions you may have still, and anything that may have resonated with you. And I know we went through a lot of information in the last 2 days, so maybe need some extra time to let the information marinate some more. And just before I forget, I go ahead to the last slide, Dawn. And of course, you guys probably got my many various emails, but I want to leave also my maternal health programs director, Dr. Garg's email and my email. And like I said, we're always happy to make new connections, and everyone will have access to the recording links, the slides, and if speakers are comfortable sharing the contact information as well, and any resources or links that they want to provide to, that will be in a document, and we'll be sending out an evaluation, of course, for both days. And we would greatly appreciate it if you took the time to fill those out, and I'll be sending that via email. And I look forward to hearing more on how we can continue bringing amazing institutes like this. So please be sure to fill out that evaluation. And yeah, so like I said, if anyone wants to join in on the conversation or share some reflections. I'm seeing all your messages now in the chat. So, and unfortunately, yeah. So, and the CEUs won't be available for this institute. I saw someone's questions.
I just want to jump on you and say that it's a tough task to facilitate for 2 days, and you did a great job, Alicia, and really enjoyed all of the presentations. So thanks.
Thank you so much. Wait, I didn't even see who said that, but that was very sweet. So thank you so much. Definitely not easy, but it's been really fun behind the scenes and seeing all your messages. I'm just happy the presenters took the time to support our institute and our mission and our values here.
Alicia, this is Cindy, and I just want to jump on the bandwagon too. This institute, really has been excellent in just the flow of it. I think it just flowed in a beautiful way. The presenters were just amazing. Yeah, there was so much work, I'm sure, that has gone into this, and it really shows. This is great, and I look forward to the next one. And the work, it's just so inspiring, all the work that is going on. Everything we've been working for so long feels like it's finally getting some traction, and hearing same messages across the country and the same knowings and the same teachings is just beautiful. So thank you so much.
Thank you so much, Cindy. I always appreciate your kind, loving words. Well, I look forward to connecting with you more. I'll be talking with you soon. So thank you for joining. Yes. Thank you, everyone. Thank you, Danielle, Mackenzie.
Thanks, Alicia.
Sorry, I'm just reading through the chat. Awesome. Well, congrats, everyone. Let me, stop recording. Thank you, everyone.